Faced with the terrifying situation of your child running a high fever, and you're left wondering about those sudden, frightening febrile seizures that can accompany it? In this video, we're here to provide you with all the essential information about febrile seizures and how to manage them. Your child's well-being is our top priority, so stick around to get the knowledge you need. Meet Channel and her adorable 7-month-old daughter, Tanya. Their days were filled with baby giggles and exploration, and Channel cherished every moment with her little one. One sunny afternoon, something unexpected happened. Tanya woke up from her nap, but she wasn't her usual happy self. She felt warm and agitated. Concerned, Channel checked her temperature, and it was higher than normal. Worried about her daughter, Channel called their pediatrician. The pediatrician suggested they come in for an examination to be safe. In the doctor's office, Tanya was examined carefully. Channel's heart raced with worry as she longed for reassurance about her baby's health. The pediatrician explained that Tanya was having a febrile seizure, which can happen to young children with high fevers. Channel listened closely, wanting to understand what was happening. She asked, "Doctor, what are febrile seizures?" A fever causes a febrile seizure in your child. These types of seizures are age-specific, happening in infants as young as 6 months and children up to 5 years old. Febrile seizures most commonly occur between 12 and 18 months of age. They're usually harmless, and most don't have a lasting effect. Simple febrile seizures are those that have all three of the following. They affect both sides of your child's body. A seizure that affects both sides of your child's body is generalized, they're short-lived. Simple febrile seizures last fewer than 15 minutes. They're isolated events. Simple febrile seizures don't happen more than once within 24 hours. If any of the three above criteria aren't true, it's a complex febrile seizure. Complex febrile seizures are more likely to require treatment and may suggest an increased risk of seizure disorders later in life. Doctor, what are the 3 main signs and symptoms of febrile seizures? Hallmark symptoms of a febrile seizure include shaking all over. A child who's having a febrile seizure loses control of muscle movements on one or both sides of their body. This usually involves shaking, stiffening, or tensing up. Loss of consciousness. Your child may pass out, or their eyes might roll back. Loss of consciousness can happen with or without shaking. Loss of control. Your child may vomit, drool, urinate, pee, or defecate, poop. Doctor, what causes febrile seizures? Fever causes febrile seizures. Febrile seizures are most common during the first day of an illness as a child's temperature rises. They're most likely with a fever of at least 100.4 degrees Fahrenheit, 38 degrees Celsius. In some cases, children will sometimes have a seizure before developing a fever. Fevers from viral infections usually trigger febrile seizures. But the fevers may be due to any type of infection. Some childhood vaccinations may cause fever, and if a child has a febrile seizure after vaccination, it is the fever, not the vaccine itself, that causes the seizure. Doctor, is febrile seizure risk goes up after having one? Children who have one febrile seizure have a higher chance of having another later on. The risk of a child having a second febrile seizure is about 1 in 3. About 10% of children who have one febrile seizure will have 3 or more throughout their entire childhood. The risk is highest in children who have a febrile seizure before turning 1 year old. What care and treatment I can do? How are febrile seizures treated? Simple febrile seizures usually don't need treatment. They rarely last more than a few minutes, and children recover quickly from them. Parents can give fever-reducing medications during febrile illnesses, such as paracetamol or ibuprofen, but these may not prevent febrile seizures from happening. Complex febrile seizures are more likely to need treatment. For children who tend to have prolonged febrile seizures, rectal diazepam may be prescribed for home use. This is typically used in case of a seizure that lasts longer than 5 minutes or if the child has more than one seizure in 24 hours. Rarely, daily prescription anti-seizure medications are used to prevent febrile seizures. In most cases, this is not necessary. Doctor, what can I do at home to treat this symptom? You shouldn't try to treat a first-time febrile seizure at home. A first-time febrile seizure needs immediate medical care to make sure that it isn't another kind of seizure or that it isn't happening because of a severe infection like meningitis. If your child has a history of febrile seizures, your healthcare provider can guide you on what to do to treat these at home. You should do the following: stay calm. Seeing your child having a seizure can be very frightening, but it's important for you to keep as calm as possible. Track the time. Note how long your child's seizure lasts. If the seizure lasts 5 minutes or more and isn't slowing down or stopping, slowly and gently set your child down on the floor. Don't set a child on a table or bed, they could fall, and don't try to hold them in your arms or hold them down, that increases the risk of an injury. Place them in the rescue position. Lay your child on their left side with their lower arm stretched straight out, so it's like a cushion for their head. This helps prevent choking from fluid, saliva or vomit, going into their lungs. Don't put anything in their mouth. That could result in an injury for your child or you. Doctor, how can this symptom be prevented? Febrile seizures happen unpredictably and are usually not preventable. Doctor, when to get emergency medical care? You should get emergency medical care for febrile seizures in any of the following situations. If this is the first febrile seizure your child has experienced. If a febrile seizure lasts at least 5 minutes and isn't stopping or slowing down. If your child has trouble breathing. If your child also has symptoms of a brain or spinal cord infection. These symptoms include neck stiffness or pain, lethargy if your child is not very active and has little or no reaction to what's happening around them. The doctor offered guidance on how to care for Tanya during a febrile seizure. Channel learn to stay calm, keep Tanya safe, and seek medical help if needed. Back at home, Channel followed the doctor's advice. She monitored Tanya's fever, kept her hydrated, and comforted her. As Channel looked at her daughter, she felt a mix of emotions, concern, love, and an overwhelming desire to protect Tanya. She knew that with the right information and care, they would navigate this unexpected journey together. In the end, Channel's love and dedication to Tanya were unwavering. Their bond grew even stronger as they faced and overcame the challenges of febrile seizures. And so, with the help of early diagnosis, swift medical care, and the unwavering support of friends and family, Tanya made a remarkable recovery. Her laughter once again filled their home, and every day was a new adventure. It's a powerful reminder that even in the face of challenges, love and determination can conquer all. If you found Tanya's journey inspiring or if you have a similar story to share, please don't hesitate to comment below. We'd love to hear from you and continue building this wonderful community of support and resilience. Thank you for joining us today, and remember, every child is a little warrior, capable of incredible strength. Stay tuned for more heartwarming stories and valuable insights right here on our channel. Until next time, take care and keep spreading love and positivity.